is how we do it. This is how we do it.
Greetings, everybody. This is Dr. J, physical therapist, and today I am going to show you how to complete your physical therapy evaluation, as well as some tricks on how to navigate Kinnser. Let's get started. First, you want to input your username, as well as your password that you have customized. Click Submit, and then hit OK. Now this screen is going to take you to your K-Mail. We will add an additional video for this. Let's go ahead and go to your Hotbox. Click Go To, Hotbox. And today, oh man, we have a very special patient, Mr. Dak Attack, quarterback for America's team, the Dallas Cowboys, if you did not know. Let's go over a few little tips. Here's how you can change the date during the week. We know home health, sometimes the schedules fluctuate. So you click the little drop down. So if we need to move Mr. Attack to tomorrow or Saturday, this is how you would do so. But we'll keep him on schedule for today. Also, if you want to know some basic demographics about your patient, this is where you will find the address, the phone number, so you can schedule, as well as the agency that referred the patient to us. If you move further down, this is how you would open your physical therapy evaluation. We'll get to that in a moment. Sometimes we have specific instructions as far as insurance. The patient may be awaiting authorization. So if you hover over this yellow sticky note, you will see that this patient has been approved for 3 visits, but we have to get the evaluation in ASAP in order to get more authorization. And lastly, this is how you would write a missed visit note. We don't want to write too many of these, but every now and then it's necessary. And we will also add a video teaching you how to write a missed visit. So let's go ahead and open up Dak's chart. All right. So this is kind of just an overarching view of what the evaluation looks like. Fairly detailed, pretty straightforward. You should have no problems completing this evaluation. We'll take it up to the top. First, you want to always make sure that this box is checked. Your patient identity, typically I'll use name and date of birth. I think that's pretty standard throughout our profession. We always want to include a time in and a time out, as well as your date. We don't typically track mileage, but in the event you're working for an agency that does, here is where you can log your miles. All right, let's move on. We've inputted our diagnosis. Mr. Dak has had a left TKA on October the 11th. PT diagnosis. Usually I set these 2 dates the same. So we'll do the 11th also. And once you've done your chart review and you've done your history with the patient, here's where you can put any relative medical history in this box, prior level of functioning, and the patient's goals, any specific precautions. Here's where you would input that information. Another must-have, we must always have this section addressed by clicking yes or no. You never want to hit no, because that means your patient doesn't need home health. If you hit no, it's going to be highlighted as red. Hey, what the heck is going on? Why are we even seeing this patient? So let's just make sure your homebound status is always checked yes. And then there are some additional line items that you can check if it's applicable to your patient. So upon doing my evaluation with Mr. Dack, I noticed that he had residual weakness. He needed assistance for pretty much everything. I mean, the guy was just discharged from the hospital today. Um, he required maximal assistance, and it's very taxing for him to leave the home right now. And if you're not seeing anything in these particular lines that apply to your patient, you can always go click into the other box and type in whatever you feel is necessary. Now, here's a trick. In order to, if you want to save your note, which I encourage you to do as you move throughout the evaluation, you want to make sure that you look for these skinny lines. The more rectangular lines, this trick doesn't work, but for the skinny lines like here and here, if you highlight them and you press enter, it will automatically save your note. Every now and then, technology fails us, you lose internet connection, and you risk the chance of losing a note. When I tell you it is very frustrating, trust me. I've almost broken my laptop quite a few times. Okay, moving along. Here we're going to address your social support and safety hazards. These are straightforward questions. Patient lives alone, has occasional short-term assistance. Any additional information you can add here in the box. Safety hazards. He had stairs, he has pets. It's kind of cluttered in his house. Patient lives in a 3-story home. His friend Zeke visits him on Monday, Wednesdays, and Fridays as needed. Some of these boxes are kind of redundant, but it is what it is. Here's a section for you to input your vitals, subjective, physical assessment. You'll fill this out where appropriate. Patient had edema. Here's a section here where I can document that. There was pain. Rated as a 5. It hurts with bending. When he elevates it on pillows, it feels better. So I documented all that. Here, a lot of our therapists are different. Some are very detailed, and some just like to get straight to the point. So if you want to go and do a muscle test for every joint, you have that prerogative. If you just want to be specific to the diagnosis, you can do that as well. I'm not here to teach you how to do an evaluation. Okay, here's where I assess bed mobility, gait, transfers. Even though he doesn't need a wheelchair, you always want to make sure you address each box. So I just put NA. Any additional tools that you use could be a tug, it could be a Tenetti, it could be a Berg, it could be a 2-minute step test. This area here is where you would document that. So for instance, balance, we've got the single leg stance, Berg balance, Tenetti, for gait, tug, and so on. And for those tests that I did not do, I just put NA. Any DME, obviously you want to document that here. This box, you can type your heart away. And as far as the assessment goes, I always want to make sure you have your goals. I usually try to do 3 or 4 short-term goals along with 3 or 4 long-term goals. Time frame really depends on the frequency that I choose. Here's my plan. I have communicated my plan with my PTA, so you want to check this box, as well as the home health agency. And we just talked about the plan of care and the frequency. You want to always make sure that this physician notified box is checked. Once you submit your evaluation to the agency, they will then fax this evaluation to the physician. So make sure that this box is checked. Okay, moving on. Statement of rehab potential. patient has potential to benefit from skilled PT? Absolutely. If not, you click no. Again, we don't want to get in the habit of clicking no. If so, this will obviously just be an evaluation only. What do we do today? We complete the evaluation, develop a plan of care. Anything else, you click this other box. We initiate the HEP, talked about DVT prophylaxis. Lastly, you want to always make sure that you put in your frequency and the duration. So the effective date is always going to be on the date of the evaluation. My frequency, we're going to start off with 3 times a week for 4 weeks. And make sure you communicate this frequency to the office so that we may schedule your patient out ASAP. Lastly, always address the discharge plan. And that's pretty much it. Don't forget to save only in the skinny boxes here. So you want to make sure the box is highlighted. You hit enter. And that, my friends, is pretty much it. This is your physical therapy evaluation in a nutshell. Once you do 2 to 3, it will be a piece of cake. Thanks for watching. I hope this was helpful.
This is how we do